Hello everybody, I am your faculty, Dr. Vijaya Goswami from Bexon Homeopathic Medical College, Assistant Professor, Practice of Medicine. Today, I am trying this new method of communication for the lecture to complete the syllabus. So, let's get started. Hope you all are doing well and are in good health and taking good care of yourself and your family, washing your hands again and again, and taking all the hygienic measures to prevent yourself and others. So stay at home and stay healthy and listen to this lecture. Today we are going to start with the functional anatomy and physiology of adrenal glands in order to understand its disorders like Cushing syndrome, Cone syndrome, etc. in a proper way. To have a better foundation, we have to understand its functional anatomy and physiology, right? The adrenal gland, as you all know, is a paired structure present on both halves of the body, that is right gland and right adrenal gland and left adrenal gland, present on the superior aspect of both the kidneys, right? On the superior aspect of both the kidneys, also known as suprarenal gland, right? And they have a flattened pyramidal shape. Let's appreciate it in a picture. As you can see, present on the superior aspect of kidneys. This is your right kidney and this is left kidney. The left kidney is slightly up and the right kidney is slightly down due to the presence of liver on right side. So, and these are your adrenal glands, the flattened pyramidal shape structures present on the superior aspect of both the kidneys, and they have 3 to 5 centimeters height, approximately 2 to 3 centimeters of width, and 1 centimeter of thickness. And they are highly vascularized structure. As you can see, they share the blood supply of the kidney, like from the superior, the middle and the inferior suprarenal arteries, from the celiac trunk and also the inferior phrenic arteries. Okay. And they are highly vascularized structure, just as your thyroid gland, which is also very vascularized structure. So these are your adrenal glands on both the kidneys, right? Flattened pyramidal shape, 3 to 5 centimeters in height, 2 to 3 centimeters in width, 1 centimeter in thickness, and 3.5 to 5 grams in mass. 3.5 to 5 grams in mass, only half its size at birth. So at birth, it is of double size. That means approximately 7 to 10 grams. But at adulthood, it remains just half of its size, that is 3.5 to 5 grams. So during embryonic development, the adrenal glands differentiate into two structurally and functionally distinct regions, that is the outer adrenal cortex 80 to 90% and inner adrenal medulla, that is 20 to 10%. And a connective tissue capsule covers the gland, right? This you can see in this picture. The outside is the capsule covering the gland, and the outer layer, structural and functional both, is adrenal cortex, comprising of 80 to 90% of the gland, and inner core is adrenal medulla, that is 10 to 20% of the gland, right? And the adrenal cortex is further differentiated into three histological zones. That is, outer is zona glomerulosa, which secretes the mineralocorticoids, mainly aldosterone. The middle layer, zona fasciculata, secreting glucocorticoids, mainly cortisol. And the innermost layer, zona reticularis, secreting androgens, right? And the adrenal medulla secrete different set of hormones, that is epinephrine, norepinephrine, and small amounts of dopamine, right? So this is a good picture showing all the summary of what we have studied till now. Anterior view showing the suprarenal aspect of the adrenal gland that is present on the superior aspect of the kidney, its structural and functional zones, outside capsule, outer layer of adrenal cortex, adrenal medulla, and the three layers of the adrenal cortex, that is GFR. One, the mnemonic is GFR, zona glomerulosa, secreting mineralocorticoids, mainly aldosterone, zona fasciculata, secreting glucocorticoids, mainly cortisol, and the inner layer is zona reticularis, secreting androgens, and the adrenal medulla secreting epinephrine, norepinephrine, and small amounts of dopamine, right? So we now get on to the next slide. The adrenal cortex produces steroid hormones that are essential for life, right? The aldosterone, cortisol, and the androgens. All the hormones are essential for life. Complete loss of adrenocortical hormones leads to death due to dehydration and electrolyte imbalance in few days to weeks, unless hormone replacement therapy begins promptly. Right? It is very fatal to have deficiency of these hormones, because death can ensue due to dehydration and electrolyte imbalance. And the adrenal medulla produces three catecholamine hormones that are norepinephrine, epinephrine, and small amounts of dopamine. So they are released during flight and fight situation, stressful situations. So now we further study about the zones of adrenal cortex. It is subdivided into three zones. Each of one secretes different hormones. The zona glomerulosa. Why it is called zona glomerulosa? Because the zona means, little meaning is belt, and glomeruli is little ball. The cells of this zone are closely packed and arranged in a spherical clusters and arched columns like a small little ball, and secrete hormone known as mineralocorticoids, because they affect the mineral homeostasis, mainly of two hormones, that is sodium and potassium. The middle zone, the zona fasciculata. Fasciculi means little bundle. The cells are arranged in long straight columns, secreting mainly glucocorticoids, primarily cortisol, so that they affect glucose homeostasis. And the cells of the inner zone, the zona reticularis, reticuli means network, are arranged in branching cords like a fish net, like net cord. They synthesize small amounts of weak androgens. Andro means man. So these hormones produce masculinizing effects. To revise, this slide is good. The superior aspect of kidney, adrenal gland, the outer capsule, outer layer adrenal cortex, inner layer adrenal medulla. The three layers of adrenal cortex, zona glomeruli, cell are arranged in ball-shaped structures, secreting mineralocorticoids affecting mineral homeostasis, mainly aldosterone. The middle layer is zona fasciculata. Fasciculi means bundle, secreting glucocorticoids, mainly cortisol. The inner layer, zona reticularis, secreting androgens, which have masculinizing effects, right? So, mineralocorticoids. Aldosterone is the major mineralocorticoid and regulates homeostasis of two main minerals, sodium and potassium, which helps adjust blood pressure and blood volume, and also promotes excretion of hydrogen ions in the urine that help prevent acidosis. So hydrogen ions are acidic in nature. So their removal from the urine can prevent acidosis. This is done by aldosterone. And the secretion of aldosterone is controlled by renin-angiotensin-aldosterone system. So the renin-angiotensin and aldosterone system can be understood with this picture. So any change in blood pressure or blood volume that may be due to dehydration, sodium deficiency or hemorrhage can cause decrease in blood volume, and which can further deplete the blood pressure or hypotension. This will stimulate the juxtaglomerular cells of the kidneys, which are like the BP apparatus of the body, which senses the decrease in the blood pressure and secretes renin. This renin will convert the angiotensinogen from the liver to angiotensin 1. Angiotensin 1. And this angiotensin 1, just a second. This angiotensin 1 will get converted to angiotensin 2 with the help of ACE, that is angiotensin converting enzyme. This angiotensin 2 is a potent vasoconstrictor of arterioles. So it constricts the arterioles so that the blood pressure increases. Like a water hose pipe, if you put a finger on it, the pressure increases. So any hormone which constricts the arterioles will increase the blood pressure, right? And this angiotensin 2 will also stimulate the adrenal cortex, which will secrete increased aldosterone. This aldosterone in the kidneys will cause sodium and water reabsorption through the kidneys and will cause their retention and the increased secretion of potassium and hydrogen ions into the urine, right? So that they will cause increased blood volume and hence normalize the blood pressure. So this picture also shows how the renin gets the secretion of aldosterone through adrenal cortex and will act on nephron on the distal convoluted tubule to cause reabsorption of sodium and water and excretion of potassium in the urine, right? The water and sodium retention will cause increased blood volume and blood pressure. Similarly, the aldosterone here will cause excretion of the hydrogen ions and absorption of the bicarbonate ions, which increases the pH and removes the acidity. These protons are excreted to maintain the pH levels of the blood. And the glucocorticoids, mainly cortisol, which maintains the glucose homeostasis and regulates metabolism, glucose metabolism mainly, and resistance to stress. The control of glucocorticoid secretion occurs via a typical negative feedback system, right? The low blood levels of glucocorticoids, mainly cortisol, stimulate neurosecretory cells in the hypothalamus to secrete corticotrophin releasing hormone, right? And the corticotrophin releasing hormone will promote the release of ACTH from the anterior pituitary. This all we have done in the previous classes, right? The ACTH will flow in the blood to the adrenal cortex where it stimulates the glucocorticoid secretion. The glucocorticoids have the following effects. Mainly the protein breakdown, the glucose formation by the liver cells, lipolysis and resistance to stress. So how does it do the protein breakdown? The glucocorticoids, mainly the cortisol, will cause protein breakdown mainly where in the muscle fibers, and thus increase the liberation of amino acids. Right? The protein, the basic unit is amino acid, and the breakdown will lead to liberation of amino acids in the bloodstream. The amino acids may be used by body cells for synthesis of new proteins or for ATP production, right? Through gluconeogenesis. On stimulation by glucocorticoids, the liver cells may convert certain amino acids or lactic acid to glucose, which neurons and other cells can use for ATP production. These amino acids and lactic acids get converted into glucose. This process is known as gluconeogenesis, right? Where normally what happens, the glycogen is broken down to glucose, right, in normal situations. But in stressful situations, the gluconeogenesis happens where conversion of amino acids and lactic acid to glucose rather than from glycogen. It is known as gluconeogenesis. And the breakdown of glycogen is known as glycogenolysis. Right? So lipolysis is the glucocorticoid stimulates lipolysis, that is the breakdown of triglycerides and release of fatty acids from adipose tissue into the blood. Right? So it causes protein breakdown, it causes fat breakdown, right? To maintain the levels of glucose in the body, maintain glucose homeostasis, right? And resistance to stress. The additional glucose supplied by the liver cells provide tissues with extra amount of energy, the ready source of ATP, to combat a range of stresses, including the normal stresses like exercise, fasting, or frightful situations, extremes of temperature like extreme heat and cold is also stress, high altitudes, bleeding, infection, surgery, trauma, and disease. So, to combat a range of stresses, this extra amount of energy will help you fight the stress. And because the glucocorticoids make blood vessels more sensitive to other hormones that causes vasoconstriction, they raise the blood pressure also. This effect would be advantage in case of severe blood loss, which causes blood pressure to drop. So it maintains the glucose level and it maintains the blood pressure, both. And it also has anti-inflammatory effects. The glucocorticoids inhibit white blood cells that participate in inflammatory response. It also retards the tissue repair and they slow wound healing. High doses can cause severe mental disturbances, but they are very useful in the treatment of chronic inflammatory disorders like rheumatoid arthritis, right? And also in depression of immune responses. High doses of cortisol will depress the immune responses, as in organ transplantation, where they are prescribed to recipients to retard tissue rejection by the immune system. Now we move on to androgens. In both males and females, the adrenal cortex secretes small amounts of weak androgens. The major androgen secreted is DHEA, that is dehydroepiandrosterone. After puberty in males, the androgen testosterone is also released in much greater quantity by the testes. Thus, the amount of androgen secreted by the adrenal gland in males is usually so low that their effects are insignificant. The main androgen is testosterone in males, so there is a nil effect of androgens in males. But in females, they play a very important role. They promote libido, they convert estrogens by other body tissues, After menopause, when ovarian secretion of estrogen ceases, all female estrogens come from conversion of adrenal androgens, right? And adrenal androgens also stimulate growth of axillary and pubic hair in boys and girls and contribute to the prepubertal growth spurt. Although control of adrenal androgen secretion is not fully understood, the main hormone that stimulates its secretion is ACTH. Now we move on to adrenal medulla. It is a modified sympathetic ganglion of autonomic nervous system. It develops from the same embryo as all other sympathetic ganglia, but its cells, which lack axons, form clustered around large blood vessels. Rather than releasing a neurotransmitter, the cells of adrenal medulla secrete hormones, right? Although being part of the autonomic nervous system, it doesn't secrete neurotransmitters, but it secretes hormones. The hormone producing cells are called chromaffin cells. Chrome means color and affin means affinity for. Are innervated by sympathetic preganglionic neurons of the autonomic nervous system. Because the ANS exert direct control over the chromaffin cells, hormone release can occur very quickly, right? The two major hormones synthesized are epinephrine, norepinephrine, and also small amounts of dopamine. 80% is epinephrine and 20% is norepinephrine. What these hormones do, they intensify the sympathetic responses that occur in other parts of the body. They intensify those processes. What does they do? They will greatly augment the fight or flight response by increasing the heart rate, force of contraction. They increase the output of the heart and increases the blood pressure. And they also increase blood flow to the heart, liver, skeletal muscles, and adipose tissue, dilate airways to the lungs, and increase blood levels of glucose and fatty acid. So here's the summary. You can see, or can take notes also. Mineralocorticoids mainly from zona glomerulosa. Potassium increased blood potassium levels and angiotensin 2 levels stimulates the secretion. Principal action is increased blood levels of sodium and water and decrease in blood level of potassium. Glucocorticoids from zona fasciculata cause increased protein breakdown, stimulate gluconeogenesis and lipolysis, provide resistance to stress and dampen inflammation and depress the immune responses. Androgens, mainly DHEA from zona reticularis cells. Control of secretion is ACTH, and what its principal action is? Growth of axillary and pubic hair, masculinizing effects in females, libido, and source of estrogens after menopause. Adrenal medulla hormones, epinephrine, norepinephrine from chromaffin cells. Control of secretion